The U.S. House voted recently to approve a bill that would repeal and replace the Affordable Care Act, known to some as Obamacare. Now, two of New Mexico's three members of the House, Michelle Lujan Grisham and Ben Ray Lujan, did not support the legislation, but Representative Steve Pearce did. What might a repeal of the ACA mean for everyday New Mexicans? What does it mean for you, for your family, or your business? Get in touch with us here at NewMexicoInFocus.org. Now, let's hear what this week's Line Opinion panelists think about the latest debate over health coverage. I'm joined at the table by Sophie Martin. She's an attorney and editor of DukeCityFix.com. Eric Griego is back. He's a former state senator. Tom Garrity, the Garrity Group PR honcho, is here. And Rachel Sam, she's editor of Albuquerque Business First. Now, Sophie, this new legislation, the American Health Care Act, what matters to you in the bill that passed in the House? And we're obviously, slogging this thing out in the Senate. We're peeling back just about a week and a half here, but reach back a little bit. What struck you when they passed that?
For starters, let's just say that the Senate has made it very clear that they're going to take a long time getting to this.
That's right.
It remains to be seen whether they will keep it until after the 2018 elections. Possible prediction there. But it seems to me that for New Mexico, the biggest issues, and there are multiple, sort of center around the concepts of affordability and access. Republicans love to use the term access when it may or may not in fact be true that there's access because that healthcare is not affordable. So New Mexico has, if not the lowest, and amongst the lowest premiums and deductibles in the country under the Affordable Care Act. That's been very good for New Mexico. I think as well it's worth noting that New Mexico had a high-risk pool prior to the ACA. There's a lot of discussion in the surrounding the AHCA around the idea of states re-engaging with high-risk pools.
Right.
One of the challenges with New Mexico's high-risk pools, and I think those pools in general, is if, say, you could get insurance, but it's hideously expensive because your pre-existing condition, and this did happen in New Mexico pre-ACA, you couldn't get into the high-risk pool because the high-risk pool was literally you needed to have no way to get insurance. And this happened to a friend of mine. She was just reminding me of this the other day. So while the AHCA, the new bill, seems to focus on, and its proponents talk about access, the issue of affordability is really important. If it's not possible to afford because you have pre-existing condition, and let me remind you that being a woman appears to be a pre-existing condition under the AHCA, then you may have real difficulty affording that access. The other big thing for New Mexico is Medicaid. We cut our uninsureds in half under the AHCA because this state government, I don't always give credit to the governor's office, this state government actually did a good job of taking advantage of the benefits available to New Mexicans under the ACA. And so many more New Mexicans are getting health care coverage now than were before. The expansion of Medicaid is a huge part of that. If we lose the ability to keep that Medicaid expansion up there, and that's certainly something that's being discussed, a big drawing back of the money that would be available to the states, a lot of people, including a lot of people in Steve Pearce's district, are going to be hurting.
That's an interesting point, Eric. I appreciate Sophie's point that we actually stepped to this thing when the offer came from the federal government. Maybe we're just good at getting federal money. This is what we do. But we could have easily gone the other way and had a big fat mess on our hands here. But with this situation, what concerns you, what came out of the House, when you consider what these folks are trying to do? Because we all agree we have to do something. Premiums are out of control for lots of families. Is this the answer, what Republicans have come up with in the House?
Well, just to go back, Senator Bingaman was on the committee that negotiated some of the final provisions and this incredible match that we get. We got 100% match, and currently it's 95%, meaning for every, we pay 5% of the cost for this expansion. So it's been a huge boon, not just as Sophie says, in coverage for uninsured New Mexicans, but just financially for the state. As we all know, the economy has not been doing well. This has been the one sector that has been buoyant, and largely because the federal government is paying 95% of the cost of that expansion. That was not by accident. Senator Bingaman, who was on the committee, and by the way, we traded away some things for this. We traded away the public option for this. I happen to be a single payer fan, so I was not a big fan of ACA, but I have to say, and I agree with Sophie, we sort of are hard on the governor. This is one area where she bucked a lot of her Republican candidates or colleagues around the country and said, this is good for New Mexico. Which is, in terms of jobs, in terms of, 15% of our state budget is Medicaid funding. But that is heavily, heavily subsidized and essentially multiplied by the federal match. So Steve Pearce is sort of out on a ledge here. He is acting contrary to New Mexicans, not just his constituents, but this has been an absolute boon for coverage, for access, for jobs. We're talking about hundreds of millions of dollars in investment in the state and the healthcare infrastructure and providing. So it's
I mean, we have four carriers or four ways to get. And hell, a lot of states have one, and soon perhaps none. So we're in a pretty good spot. Let me move to Rachel on this as well. You know, obviously I mentioned there's a bounce for business, and I'm going to talk to Tom about this as well. But it's the lack of clarity, I have to imagine, is a difficulty for business right now. They just don't know where this is headed, do they?
Absolutely. Just at every level, the uncertainty over this is like a cloud hanging over people from the individual level. If you don't know if your condition is going to get covered, you know, you're not going to make investments. There's certain plans you're not going to make. And same with business investments and expansions. Probably not so much considered when people aren't sure how much they're going to have to pay for healthcare if they're covering their employees.
That's right. We have some businesses that kick in a little bit to help their employees. They're unsure about that. There's just a lot of different ways this could go. And Tom, I know we've talked about this before while you've been at the table, and you provide, you know, the things you provide for your employees as well. You don't have a giant shop, but the size of the shop that you do have is a bit of a difficulty, though, with trying to manage all this. How are you approaching this? What do you think about all this?
Well, you know, by means of disclosure, you know, firm does work with New Mexico Health Insurance Exchange. The opinions are my own and feedback. You know, from a business perspective, you have to, you know, you can either get wrapped up in the paralysis of analysis of like what's going to be happening, or you can just decide, you know what, this is the law of the land right now, and we're going to continue to move forward. And I think that, you know, the paralysis of analysis is what we're seeing right now. You know, the House bill, you know, of the AHCA has passed. And the only reason it passed is because concessions were made to the Freedom Caucus. And so, you know, when it moves over into the Senate, you know, as Sophie and Eric have mentioned, you know, we're going to see some really dramatic changes. It's on a slow boat. You know, nothing is going to happen overnight. But yet, that's what all the TV talk shows and a lot of this one excluded, of course. But you know, you have a lot of people who are, you know, the chaos is overtaking, and they're thinking, what if? And I think as a society, it's good to be aware of what's happening, and it's excellent to be involved and making sure that our voices are heard in Washington. But from a business perspective, I think what we really need to do is just remain focused and say, here's what it is. And if small businesses can afford it, then, you know, we should celebrate it. And there are a lot of great options. You know, my company is on the health insurance through the exchange, and there are a lot more options as opposed to, you know, the independent brokers and such.
Interesting.
I think what's worth noting is that some businesses are reacting very quickly, and in particular, those would be the health insurance companies.
Gotcha.
We're already hearing now that health insurance companies are asking for large rate increases, not necessarily because their expenses are higher, but because the risk is higher. What they're articulating right now as they go to the states and say, you know, we need more money, we need to raise our premiums, is in large part because we don't know what's going to happen, and we need to sort of buffer ourselves against that. So there is one part of the industry where that's happening, and I think it will be interesting to see the different sides of the debate address that issue. My expectation, you won't be surprised to hear me say this, is that proponents of the AHCA will say, look at that, Obamacare premiums are through the roof, not acknowledging that it's the uncertainty that has caused at least a decent chunk of that increase.
It's also uncertainty from the carrier's point of view, Eric. They need some guidance on how to do this. To Sophie's point, well, let me go back actually. There was wiggle room because nobody knew what the rates were going to be when this whole first started. The feds had a system to kind of cushion the blow for these guys. But now they're really not quite sure, are they? It's very, very interesting how this works.
Yeah, I mean, I think Sophie sent around this great piece from the New York Times that sort of demonstrated this and other points, which is that the states that really bought in, like New Mexico, regardless of partisan differences, and sort of worked with the industry and worked with providers and really sort of decided we're going to try to make this work, have been successful. The narrative that is out there in the House, which is exchanges aren't working, access is terrible, premiums are going up, is sort of a self-fulfilling prophecy. And in a lot of ways, I think it was sort of sabotaged because they did not want it to work. And they give the example in this piece that Sophie sent around from the New York Times, and everybody should take a look at it, that Oklahoma elected officials at all levels really work to undermine it. And guess what? They have terrible coverage, higher rates, higher premiums.
That's right.
And it's basically the system isn't working. So part of this is sort of, are we willing to try to make it work regardless of partisanship, you know? So.
There you go. Exactly. We'll have to end it there. As we sat down to tape this week, we learned that the Supreme Court, by the way, will not hear a lawsuit that challenges Governor Martinez's vetoes of higher education in the legislature. Go to NewMexicoInFocus.org to hear what our line panelists had to say about that announcement.